Hi, in this video we shall talk about the internal and external organs of the female reproductive system. The primary organ of the female reproductive system is the ovary, which produces the female germ cells or the ova and secretes the hormones estrogen and progesterone. Each ovary arises on the posterior abdominal wall in the lumbar region during early fetal development. During embryological development, the ovary is interrupted early in its downward journey by the round ligament and is retained in the true pelvis. The uterus serves as a site for implantation and nourishment of the developing embryo or the fetus. The cervical portion of the uterus sits into the vagina and forms a fornix on either side of the lower cervix. The uterine tubes or the fallopian tubes provide a conduit or a passage for the newly fertilized or unfertilized ovum on its way into the uterus. The uterine end of the fallopian tube can also be an implant site for a confused fertilized ovum that implants there. This causes an ectopic pregnancy, which is potentially a life-threatening event. The vagina is a fibromuscular sheath. It receives the penis in sexual intercourse, provides a path for semen to reach the uterus via the cervix, and also acts as a birth canal for the newborn. The ovaries are connected to the uterus by the ovarian ligament. The ovaries are also connected to the walls of the body by the suspensory ligament of the ovary, which forms the posterior part of the broad ligament. Between the uterus and the rectum, we can find the recto-uterine pouch, which is enclosed by parietal peritoneum. The round ligament of the uterus holds the uterus in an antiflexed and an anteverted position where the uterus is bent forward at an angle over the urinary bladder. Between the urinary bladder and the uterus, we can find the vesico-uterine pouch, which is also enclosed by parietal peritoneum. The pubic symphysis of the pubic bones are located anterior and superior to the urinary bladder. They are held in place by the pubic ligaments. The external genitals are located in the superficial perineum. The labia majora are fat-filled folds of skin that arise anteriorly from the anterior commissure of the vulva. They do not merge posteriorly and therefore become part of the skin over the perineal body. Medial to the labia majora and on either side of the vagina and urethra are two thin, non-fatty folds of skin known as the labia minora. The space or cavity between the labia minora is the vestibule into which the vagina and the urethra open. These smaller labia can be followed anteriorly to the glans and body of the clitoris. Folds of the labia minora pass over the head and body of the clitoris, forming the prepuce and the frenulum. Unlike the labia majora, the labia minora merge posteriorly over the perineal body. This fusion is indistinct after sexual activity begins. The clitoris has an erectile crus which arises from each ischiopubic ramus. The two crura then join in the midline to form the erectile body or the corpus of the clitoris. This body is enclosed in fascia and capped by a skin-covered vascular sensitive glans clitoris. The rigidity of the clitoris is accomplished by the same mechanism operative in the penis. However, the clitoris, unlike the penis, does not incorporate the urethra. The erectile bulbs of the vestibule are separated into two bodies. They are covered by the bulbus spongiosus muscle and protrude into the vagina during sexual stimulation. The immature vaginal orifice is often closed or partly so by a thin mucosal membrane known as the hymen. The mature vaginal orifice is often surrounded by a thin remnant of this mucosa that was often torn with general physical or sexual activity. Thanks for watching. Please like this video and subscribe to the channel. More videos coming up. See you in the next one.